Historically, quantitative research has been prioritized when informing healthcare decisions made by clinicians, managers, and policymakers. It is undoubtedly important to collect quantitative data on the outcomes of different healthcare processes and interventions to help understand the relative risks, benefits, and costs of these interventions. However, this is only one piece of the puzzle. Decision makers are using qualitative research evidence to better understand health systems, socioeconomic contexts, and communities. Qualitative studies have provided significant contributions to health services and policy research, specifically with conceptualizing health, illness, the dynamics of interprofessional teams, and aspects of the delivery of care. There is a growing research interest in eliciting patient views and a growing interest in patient involvement in health policy. This is where qualitative research has been used to connect these two evolving areas to better meet the needs of the patients. There are gaps within quantitative research that would be better suited for qualitative research strategies, and qualitative methods can be used to help clarify both independent and dependent variables found in quantitative studies. Qualitative research can help with the theoretical explanations of the findings within quantitative studies. Qualitative research can be used to explore complex issues and experiences of phenomena in the lives of patients with client-centered and evidence-based practice. We can also use it to link this generated information to current rehabilitation and social theories. Contextual information, the feasibility of interventions, information about complex issues, and the appropriateness of interventions within the patient's lives are areas that qualitative research is designed to explore. The findings can help inform a more holistic picture of the patient's needs surrounding something like an intervention, or the experiences and perceptions of those experiences from the patients. For example, quantitative research studies have demonstrated the efficacy and safety of less invasive techniques and post-operative protocols for total hip replacement surgery. These quantitative studies have explored pain, function, costs, and risk of adverse events and demonstrated that same-day discharge from hospital was safe and effective for patients and cheaper for the hospital. But how do patients and their caregivers feel about being discharged from hospital shortly after their surgery? And how can we ensure that the patient's needs are comprehensively met in introducing this new pathway? This is where qualitative research helps to fill the gaps. Churchill and colleagues' qualitative interview-based study examined perspectives of patients and their caregivers regarding same-day discharge from hospital. This study identified challenges related to expectations for recovery, medications, and their impact on mobility, and the timing of post-operative education given the compressed timeline of discharge. These insights were then utilized to optimize the pathway and resulted in care process changes at the hospital. Other hospitals looking to adopt this pathway can consider some of the challenges presented in the qualitative study to preemptively tackle potential patient and caregiving concerns with same-day discharge. Quantitative research may lead to the development of theories surrounding certain diseases and how they progress, while qualitative research can expand on current theories and be used to provide new insights into patient experiences and perspectives. For example, many quantitative studies have demonstrated that people with mental illness experience occupational challenges and have poor life satisfaction. As this broad impact has been better understood, clinicians have recognized the need to move beyond quantitative variables such as readmission rates and symptom severity in persons with mental illness and attend to more multidimensional overarching variables. In response to this, Laliberte-Rubman and colleagues study the perspectives of people with schizophrenia by investigating the meaning of quality of life and the factors perceived to be important to it. New insights and priorities to these meanings and factors that were not previously discussed within standard quality of life assessments were discovered in this qualitative study. Quantitative research studies have demonstrated that the use of computerized decision support systems, or CDSSs, in healthcare can reduce morbidity, improve the appropriateness of medication prescribing, and detect adverse drug reactions early. Despite this promising evidence from quantitative studies, there has been limited uptake of their use in clinical practice. To help facilitate effective implementation of CDSSs, a qualitative study was done exploring the barriers and facilitators to the uptake of these systems in hospitals. The participants were diverse health professionals that were at different stages of the adoption. This information was used for considerations of the broader social, cultural, and institutional influences that impact the support computerized decision support systems get at these different stages of adoption, and that help describe the gradual process in which these systems become adopted. Practitioners can look at the quantitative physiological outcomes of health issues with patients, such as the decline in their vision, and then also see the qualitative research side discussing factors such as the social support they perceive to be getting, the important factors to the clients in this context, and adjustments they may have needed to make to their daily lives. This information can be used to challenge taken-for-granted practices or help evolve interventions and create new or alternate interventions. Qualitative research can be used to uncover hidden meanings and perspectives of patients. It can also help us understand a culture, whether that be a community of people living in the same area, the culture of a workplace, or the culture of a group of patients sharing the same intervention strategies. Qualitative research can also help in understanding the practitioners themselves and the reasoning they take when implementing new ideas and evidence-based practices.